Let's get straight to it. These are the 9 medications doctors are warning could be silently triggering rapid memory loss and even accelerating dementia in seniors, especially when taken long-term or in combination with other drugs. Number 1. Diphenhydramine. Often sold under the brand name Benadryl. It's found in allergy pills, sleep aids, and cold medicine. It blocks acetylcholine in the brain, a chemical critical for memory and learning. Long-term use has been strongly linked to cognitive decline. Number 2. Oxybutynin, used for overactive bladder. It's one of the most anticholinergic drugs prescribed to seniors, and studies show it may contribute to confusion, memory problems, and rapid mental decline. Number 3. Amitriptyline, a tricyclic antidepressant that's still used for depression, chronic pain, and sleep. It has a high anticholinergic load and is associated with long-term memory impairment. Now, before we go into the next medication, please hit the subscribe button to support the channel. Number 4. Alprazolam, Xanax, part of the benzodiazepine family, often used for anxiety and sleep. Benzos slow brain activity and are linked to reduced memory, concentration problems, and increased dementia risk in older adults. Number 5. Esomeprazole, Nexium, a proton pump inhibitor for acid reflux. Long-term use can lead to vitamin B12 deficiency, which is directly tied to cognitive decline and memory issues. Number 6. Risperidone, an antipsychotic sometimes used in seniors to treat agitation or sleep problems. It's associated with increased confusion, sedation, and in some cases, faster cognitive decline. Number 7. Zolpidem, Ambien, a sleep medication that can lead to brain fog, confusion, and falls. Long-term use has shown possible links to cognitive decline, especially in seniors with slower metabolism. Number 8. Cyclobenzaprine, a muscle relaxant often used for back pain or tension. It also has strong anticholinergic properties and can impair memory, attention, and alertness over time. Number 9. Chlorpheniramine, an older antihistamine still used in cold medications and allergy relief. It's a known anticholinergic and has been linked to slower thinking and memory lapses. If you or someone you love is taking any of these medications, especially in combination, it doesn't mean you're guaranteed to develop dementia, but it does mean you need to take a closer look, talk to your doctor, and understand the real risks. These drugs are often prescribed without clear warning. Many are available over the counter, and because the symptoms develop slowly, they're easy to miss or blame on age. That's what makes them dangerous. Next, we'll break down how these medications harm the brain, what warning signs to look for, and what safer alternatives may be available, so you can stay sharp, independent, and protected. Now that you've seen the full list, let's go deeper. Let's talk about how exactly these medications affect your brain and what makes them so dangerous, especially for people over 60. Many of the drugs we just listed have something in common. They interfere with a brain chemical called acetylcholine. This chemical is essential for memory, attention, and learning. It's like a communication line between brain cells. Without it, thoughts don't connect as quickly. Memory becomes patchy, focus gets harder, and over time, your brain function slows down. Drugs like diphenhydramine, amitriptyline, chlorpheniramine, and oxybutynin are all classified as anticholinergics. That means they block acetylcholine. And the problem is, the older we get, the less acetylcholine our brains naturally produce. So when you take one of these drugs, especially long-term, you're making that natural decline worse. And it's not just theory. Multiple large studies have shown that long-term use of anticholinergic medications is associated with an increased risk of developing dementia. One of the most well-known studies followed over 3,000 adults aged 65 and older. Researchers found that people who had the highest cumulative exposure to anticholinergic drugs had a significantly higher chance of being diagnosed with dementia later in life. It wasn't a small difference. It was measurable and serious, and yet these medications are still being prescribed, often without warning, and in many cases they're being used for conditions that could be treated differently. Let's also talk about benzodiazepines like alprazolam, or brand names like Xanax and Ativan. These are often given for anxiety, panic attacks, or sleep problems, and while they work well in the short term, they also slow down brain activity. That's their job, but in seniors that can lead to slower thinking, confusion, and in some cases, acceleration of memory decline. Some studies suggest that benzodiazepine use for more than 3 months can increase dementia risk, especially in people already experiencing mild memory issues. And the longer you take them, the greater the risk. Then we have drugs like Zolpidem or Ambien. These are Z drugs that help with sleep, but they act on the brain in a similar way to benzodiazepines. They don't just make you drowsy, they reduce your brain's natural activity. And if taken every night, your brain may begin to depend on them, weakening its own ability to regulate sleep and memory over time. What about proton pump inhibitors like Nexium or Prilosec? These don't affect acetylcholine, but they impact brain health in a different way. They reduce stomach acid, which sounds good for reflux, but also reduces the absorption of vitamin B12. And a deficiency in B12 can cause nerve damage, mental fog, and long-term memory loss. Most people don't even realize their brain fog is coming from something as simple as low B12, but PPIs are a common hidden cause. And then there are antipsychotics like risperidone, sometimes prescribed to older adults with dementia or sleep problems. While they can reduce agitation, they come with a cost: drowsiness, confusion, and faster overall decline. They should be used with extreme caution, especially in elderly patients. You might be thinking, but I need these medications. What are my alternatives? Let's talk solutions. Because while this list of medications may sound scary, there are often safer, equally effective alternatives available. You just need to know what to ask for. Let's start with anticholinergic drugs like diphenhydramine, oxybutynin, and amitriptyline. If you're using Benadryl or other allergy meds for sleep or sinus issues, ask your doctor or pharmacist about non-anticholinergic options like loratadine or cetirizine. These newer antihistamines tend to have far fewer effects on the brain and are much less likely to impair memory. If you're taking amitriptyline for chronic pain or insomnia, there are safer alternatives that don't interfere with memory. In many cases, gabapentin, melatonin, or even low doses of trazodone can help manage symptoms without the heavy anticholinergic load. For those dealing with bladder issues and prescribed oxybutynin or poltradine, it's worth asking about newer medications like mirabegron, which works differently and is generally better tolerated in older adults. It treats overactive bladder without crossing into the brain as aggressively. Let's move to benzodiazepines like alprazolam. If you're using these for anxiety or sleep, talk to your doctor about whether cognitive behavioral therapy, breathing techniques, or natural sleep aids like magnesium or melatonin could help you cut back. Long-term benzo use is one of the strongest contributors to memory issues in seniors, and tapering slowly under medical guidance can make a big difference. If you're struggling with chronic insomnia and you've been prescribed Ambien or other Z drugs, you're not alone. Many people take these without realizing the cognitive cost. Fortunately, sleep hygiene strategies like setting a consistent sleep schedule, avoiding screens at night, reducing caffeine, and using calming supplements like valerian root or L-theanine can go a long way. In some cases, low-dose doxepin, a different kind of sleep aid, may be safer in older adults. When it comes to acid reflux, proton pump inhibitors like Nexium or Prilosec are often used longer than they should be. If you've been on one for more than a few months, ask your doctor to reevaluate. Could your reflux be managed through smaller meals, avoiding late-night eating, raising the head of your bed, or using short-term H2 blockers like famotidine instead? And for antipsychotics, especially risperidone, if you or a loved one is taking this for behavioral issues related to dementia or sleep, it's critical to understand that these medications are not meant for long-term use in elderly patients. Behavioral strategies, structured routines, environmental changes, and low-dose melatonin or natural calming techniques may offer safer, more sustainable support. Always speak to a qualified provider before making adjustments. The bottom line is this: many of the most dangerous medications for brain health are still being given to seniors who don't know they have options. You do. And asking the right questions is the first step toward protecting your mind. Here's what you need to remember as we wrap up. Medications are powerful. They can help us feel better, sleep better, and manage pain or anxiety. But they also come with side effects, some of which don't show up right away. When it comes to your brain, the effects are often subtle at first. A little more forgetfulness, a little more confusion, a little less sharpness than you're used to. But over time, those small changes add up, and what seems like normal aging could actually be the quiet result of medications that were never meant to be used long-term, especially not in older adults. If you're taking any of the medications we covered in this video, even if you've taken them for years, don't panic. Just pause. Start paying attention. Talk to your doctor. Review your options. Ask about safer alternatives. And if changes need to be made, make them slowly and carefully with the support of your healthcare team. And even if you need to stay on a medication that carries some risk, there are still things you can do to protect your brain. Get quality sleep. Move your body every day, even if it's just a walk. Eat real whole foods, especially leafy greens, berries, and healthy fats. Challenge your brain with reading, puzzles, conversation. Stay connected to people. Stay curious. And above all, stay informed, because your brain is one of your most precious resources, and protecting it is one of the most powerful things you can do to stay independent, present, and engaged, not just for yourself, but for the people who love and rely on you. If you found this video helpful, please hit that subscribe button. We release weekly videos that give clear, practical advice on how to stay sharp and strong after 60, without the hype, confusion, or fear. And if you've experienced brain fog, forgetfulness, or a medication-related memory issue, share your story in the comments. You never know who your words might help. Thanks for watching, and take care of your brain, because with the right support, it can take care of you for years to come.